head and neck is not an easy part of anatomy. It is a very difficult one indeed. So I'm just going to simplify it and make it easier. So head and neck is what we're going to do, and head and neck consists of skull. These are the bones that we'll be talking about. Skull. I hope it's visible. Then there's the hyoid bone, and then the cervical vertebra. So the bones of the skull are 22. Hyoid bone is just one bone in the midst of the neck, so 1, and the cervical vertebra are 7 in number. Skull bones are paired, and they can also be unpaired. While the hyoid bone there are two parts of the skull. The brain part, that is the cranium, and then there's another part which is the facial part of the skull. So there are indeed two parts of the skull. Coming back to the skull, skull, as we know, has two parts: the brain box, it can also be called the cranium, and the face part. So the cranium it's called cranium, the calvaria, and the brain box, of course. It has 8 bones, while the face has 14 bones. These bones, we can name them as, the names are frontal, nasal, maxillary, zygomatic, mandible, parietal, temporal, occipital, lacrimal bone, inferior, nasal, concha. Then there is the ethmoidal bone, or we call it ethmoid bone. The vomer, the sphenoid bone, and the palatine bone. So these are all, but now you'll be thinking that these are just 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 bones. Yet we were saying that there are a lot of bones and that they should be 22 in number. So these bones, which I'll write 2 in front of, are the paired bones actually. So the frontal bone is unpaired, the nasal bone is paired, maxillary bone is paired, zygomatic bone is paired, mandible is 1, parietal bone is paired, temporal bone is paired, occipital bone is unpaired. The lacrimal bone is paired, inferior nasal concha is paired, ethmoidal bone or the ethmoid bone is unpaired, the vomer is unpaired and the sphenoid is unpaired, while the palatine bone is paired. Now I'll show you these on an atlas. Use any atlas you want, but this one is Frank H. Netter's atlas for anatomy, human anatomy. I find it very helpful, so I'll recommend you buy this one or any other version of the same atlas, because this is actually really good. Okay, so we have to identify the bones that we just studied. The first one was frontal bone. This whole blue one you can see is the whole frontal bone. This one is the frontal bone and you can see it's unpaired. Then we have the nasal bone. This orange one over here is the nasal bone. I'd like to, yeah. So this one is the nasal bone. The next one that we did was the maxillary bone. So we can see that this one, I want to see, yeah, maxilla. This whole is the maxillary bone, the green one. This is its frontal process, and this is it. This is the zygomatic process of the maxillary bone. So this is the whole maxillary bone. Then we have the zygomatic bone. This is the zygomatic bone, this orange one. And over here we can also see the zygomatic bone. So the nasal bone is paired, the frontal bone is unpaired. We can see a suture between it, so it's unpaired, while the maxilla is all joined up. There's no suture, so this is unpaired. This is zygomatic bone and this is a paired bone, because this is on the both sides over here and this side. So then there is the mandible. This one here, the gray one, is the mandible, and mandible is an unpaired bone as we did earlier. Moving forward, there we did parietal bone. I want to show you everything I possibly can on this. The parietal bone will not be in the anterior view, so we'll do it later, but we can see the temporal bone over here. This one, this red one at the side, I'm not sure if you can see it properly right now. This one, the red one on the side, is the temporal bone. Now the occipital bone is at the back, so you cannot see it from here. The lacrimal bone, I think you can see it here. Yes, this one, this purple one, this and this is the lacrimal bone, and this is a paired bone. Now the inferior nasal concha should be somewhere here. This is the inferior nasal concha. This one inside, this here. These are like the projections, the bony projections inside the nose, and you'll do it later. This is the inferior nasal concha. Then there's the ethmoid bone, that is somewhere here. So we'll have to see if we can find it. Ethmoidal bone, it's not marked though, so I'm trying to find it for you. I'm not being able to. So with the ethmoid, actually this is this one. Let me show you. I can know, yeah, this one, this gray one, this triangular thing that you can see over here is the ethmoidal bone. Then there's the vomer. This one is the vomer. It is making this whole thing, this long thing is the nasal septum. So the vomer is making the lower part of the nasal septum. This is the vomer, and then this is the perpendicular plate of the ethmoidal bone, and these are making the vomer. And there's another third bone, that is this one, the anterior nasal spine of the maxillary bone. So after this you can see septum. Yeah, we'll do it in the nose when we'll study nose. Sphenoid bone, you cannot see, I think you can. This is the greater wings, the sphenoidal bone. You can see the lesser wing of the sphenoidal bone over here in the orbit. This whole thing is the orbit where the eye is. So, and this is the orbit is formed by the a part of the orbit is formed by the lesser wing of the sphenoid bone, this part. Then this is the greater wing. This is the greater wing of the sphenoid bone. And over here, this yellow, the whole yellow thing over here, here. This is the greater wing of the sphenoid bone. Now we have to talk about the palatine bone, this which can also not be seen. It is inside the mouth, the roof of the oral cavity indeed. I can actually find it for you. I'll show you some of those. Wait. Okay, so this is the superior view of the skull, and I'm trying to show you this as properly as possible. So we have put it down. There's a lot of brightness. Okay, so this is the superior view of the skull. This is the anterior side and this is the posterior side. So you can see this part. This is the blue one, is the frontal bone. Now this one is the parietal bone. One parietal bone and the other parietal bone, like the right parietal bone and the left parietal bone. And this one, this that you can see, is the occipital bone. From the posterior view you'll be able to see it properly. Anyways, so this suture between the parietal bones and the frontal bone, two parietal bones and one frontal bone, not between the parietal bones but over here, this part. There's a suture, and this suture is called the coronal suture. You need to remember this. This is very important from the Viva point of view. Then between the two bones, the parietal bones, there's a suture called the sagittal suture. This is the sagittal suture. And over here, this suture over here, it is the lambdoid suture, which is between the parietal bones and the occipital bone. And this is the small bone. You'll study about it in general anatomy. The bone, sutural bone. This is a small bone over here. It is called the sutural bone. It is not important because it is just not important. Anyways, there are foramens over here and here. These are the parietal foramens that you can see from this aspect. Anyways, that is it. I'm dragging it a lot, but this is how it is. And this is the basics, so I just don't want to mess this up. This is the brain box. Skull can be divided into two parts, the brain box and the face. I'm gonna do it as fast as I possibly can. So the brain box can be divided into the paired and the unpaired bones, and so can be the facial part, paired and unpaired. Just make these notes in your copy and the neatest possible way so you remember them later. So the paired ones in the brain box are parietal bone and the temporal bone. So being paired means that these are two in number. So unpaired ones are the frontal, in the brain box we're talking about, occipital, sphenoid bone indeed. Okay, so the ethmoid bone. And in the face, the paired are about 6 in number. Nasal, lacrimal, maxillary, zygomatic, inferior nasal, concha, and the palatine bones. And I hope that you will be able to recognize them on the face, on the skull if it's given to you. Now the unpaired ones are just two, mandible and vomer on the face. And maxillary bone has an intermaxillary suture between it, so it is also the a paired bone. I was confused about it, I'm sorry. Next, so this is the next part of the head and neck that we're going to do, and this part we're going to do a bone that are very important, bones that are very important in this region of the body or the skeleton. So the temporal bone is what we're going to discuss. It has 5 parts, and those parts can be named as squamous part, mastoid process. If you've already been taking the anatomy classes, you'll be aware of these parts. Zygomatic process, the styloid process, and the petrous part. Now you can write it in brackets in front of these parts that the squamous part is a flat part at the side of the skull. The mastoid process is also at the side of the skull. It's a little behind the ear. You can feel it with your finger. And the zygomatic process is also at the side of the skull. The styloid process is at the base of the skull. And the petrous part is in the interior of the skull, and it is between the middle and the posterior cranial fossa. Now we'll discuss the frontal bone, and in the frontal bone just write down whatever I'm speaking, so it's easier for you because I'm trying to explain it more than to just write it down. So the first part, you can write the first point is that there's an orbital plate of the frontal bone which is making the roof of the orbit. So if we make the orbit like this is the orbit side view, and then we make this, and over here we go like this. So this is our, I'll actually demarcate it for you. The marker one, the dark one, is the frontal bone. This is the orbit, this is the roof of the orbit, this is the base of the orbit, and the orbit is conical, as you can see in the diagram. So this part, that is 1, is the orbital plate of the frontal bone, making the roof of the orbit. You should know it. Then there are 4 nasal air sinuses that you need to know about. So first thing we know is that there's an orbital part making roof of the orbit, and this is the orbital part of the frontal bone. And then the second point is that there are 4 nasal sinuses, but only one of them is concerned over here. We are concerned with this over here almost. There is a frontal nasal sinus. So this is one point. There are 4. We'll discuss the other 4 in later stages, but this one is over here. And then there's the third point is that the orbital plate of the frontal bone makes the floor of the anterior cranial fossa as well. So above this part over here there is the anterior cranial fossa, and over here this is making the roof of the orbit while the floor of the anterior cranial fossa. So there are 3 parts of the frontal bone: orbital, squamous, that we can see this part is squamous, and then there is the nasal part. Now the occipital bone, about which I'll speak as less as possible. So it is number 1. The occipital bone has foramen magnum, the biggest of the foramens, and it is the largest foramen in the skull. And the second point that we need to know about it is that we need to know a lot about it, but for now this is important, the occipital condyles. These occipital condyles will make joint with the first cervical vertebra. The first cervical vertebra is called the atlas vertebra. So this actually makes joint with that. And if we said this is the occipital bone, this is our big foramen magnum, and over here, so this is the foramen magnum, and this over here are the condyles. These small circles, these and this and this are condyles, and this bigger one is the foramen magnum. I'm sorry about the writing. I'm trying to record it in as less time as possible because I really do not have much time. So in both of the sides of the maxillary bones, we can see that there are maxillary air sinuses which are paired. So maxillary air sinus, from the anterior view we can see that these are just below the orbit. So now if we come to the orbit, right now we know that the roof of the orbit is formed by the orbital plate of the frontal bone, while the base is formed by the maxillary bone. So the base of the orbit, if we made the orbit like this, so this part over here is formed by the maxillary bone. Orbital process of the maxillary bone. Then the infections and the tumors. There is a clinical about it. Then the infections and the tumors of the maxillary air sinus happen, and then they push when these tumors develop in the air sinuses, in the maxillary air sinus to be precise. That will cause it will cause the pushing of the eyeball. It will actually push the eyeball outside, and that will be called proptosis. So I hope this is clear. These small, seemingly unuseful diagrams that I'm making are actually very important for you to understand it again if you wish to revise it any time soon. So just make these properly. I'll show you my notes at the end, how I made them. So over here, this diagram, this is the orbit. You can see the conical shape. This is the frontal bone. This hole is the maxillary bone. See, and over here we can draw lines like there's this part and there's this part. These are the teeth. This is something important you'll understand later on. And over here, the little distance, you can for the sake of understanding, this one over here is the hard palate. Till here it is the hard palate, and this is the soft palate. The soft palate is actually made up of muscles, and the hard palate is made up of bone. So anterior 2/3 of this part, the palate, if we discuss the palate, anterior 2/3, my hands are actually very sticky because I just made some cookies, so I didn't wash my hands, I guess. Anyways, so the anterior 2/3 is the hard palate. I'm sorry about the writing though. And posterior 1/3 is the soft palate. You can write these in bold so you can understand. This hard palate again can be divided into two parts, anterior 2/3 this part is formed by the maxillary bone. So to be precise, which you should be, it is formed by the palatine process of the maxillary bone. And palatine process. And over here the posterior 1/3 is formed by the palatine bone. And now the palatine bone can be of the horizontal plate of the palatine bone. Horizontal plate. Just when you make your notes, just make them just a little pretty. Maybe I'll show you mine later, or maybe right now. I wrote them like these, as precise as possible.